Okay. Hi, I'm Sara Protto from Tampere University Hospital, and I'm here with Dr. Maria Tsitskari from Cyprus, Greece, to host the Cersei European Trainee Forum Meet and Greet session. So during this session, we will speak about women in IR and IR gender gap. And then the Cersei supports the next IR generations and how to prepare for the EBIR. So while both sexes are equally represented in diagnostic radiology, it's not the same for interventional radiology. And it looks like that women are less likely to choose IR as a career. IR was even ranked last in female representation among radiology subspecialty fellows. And over the last 20 years, has been not seen any changes and there has been no increase in female representation among IR fellows or faculty. The situation is similar between Europe and USA. In UK, for example, 35% of all radiology consultants are female, but if we look to IR only, just 10% of consultants are female. The same situation we see in USA, where ER consultants are about 7%, while, for example, medical school graduates are 50%, or pediatric radiology fellow are 50%, and even vascular surgery trainees are about 30%, even though surgery trainee is not so different from interventional radiology trainees. So if we think that over 50% of all medical students are women, is it essential and really important to raise awareness between students and attract more women into the ER workforce? Bichet has done a survey between 143 medical students, female, in 2017, and he tried to understand the reasons to not consider ER as a career. And they found out that one of the reasons why IR doesn't compel female, is not interesting for female medical students, is the lack of exposure to IR in medical school, which is anyway a problem also for male. Work-related exposure to radiation was another reason, length of training, of course, work-life balance, and lack of female role model. The same thing was studied by Matsumoto, who tried to understand gender-specific factors who were influencing the choice of IR between medical students. In this case, she asked female and male students to answer a few questions, and she tried to understand what were those factors. Actually, there was not so a huge difference between male and female, except for one, so the access to female IR members and the access to female IR mentors and diversification of the currently male-dominated workplace looked to be really important for the female student. Here, for example, we see all the different factors, and if the medical schedule, turf war with other specialty, lifestyle hour were important factors for both female and male, as for example, the radiation exposure levels, male-dominated workplace was revealed to be a really important element between female students. So what we can do to overcome the obstacles? Of course, create a network between women and encourage visibility of female IRs is of central importance. In real life, anyway, the overwhelming majority of IRs are male. And Cersei did a survey in 2017, trying to understand the gender gap in IR. And during this survey, they tried to understand which was the gender ratio in IR teams in Europe. And actually, they found out that in 69% of cases, in the ER team, we have just one female. In 15% of cases, the female constitutes less than 50% of IR team. And just in 5% of cases, we have a female predominant IR team. The reason, of course, can be many. For example, the fact that we have actually lack of female trainees that will eventually become part of AR team, or the fact that many abandon the trainee program, but also, for example, the imposter syndrome, which is present more visibly in highly achieving women, and is a situation where the person who suffer from it doesn't really feel to be intelligent, or doesn't feel to deserve the place she or he got, and I think it's just for chance that she got to be in this place or in this situation. So that's why probably many women are not so pushed, are not so eager to apply, for example, for faculty or to speak in congresses and so on, because they don't feel like they are good enough for it. And to encourage the visibility of female, we have really to push women also to apply and to be at the center of the scene. Moreover, a problem, as we told, is the radiation exposure. And of course, this is related not just to female, but also to male. But when we speak about pregnancy, of course, it touch more the female group of IR. And even though it has been demonstrated that the fetal exposure in interventionist and non-interventionist around zero in both groups. Anyway, in many countries still it's not possible to do radiation work during pregnancy. And this can be even used from interventional radiology as a positive thing. For example, to do research, to study, to learn new diagnostic tools that can be useful during the future interventional radiology work. So sometimes it can be even good to stop for a while the clinical work and doing something different. Of course, have a role model is of central importance, someone who inspires and pushes you to be better. And a role model normally is someone who inspires and serves as an example. And you don't have to know this person. It can be someone, of course, you know and you work with, but it can be also someone you have never met. For sure, really important in a role model would be the ability to overcome obstacles. One of the quality a role model normally has, who is, for example, for me, really inspiring and push me to go through all the obstacles I find during my career and in even everyday life. And also really important is a passion for what she or he does. That is for sure inspiring for everyone. So if we look more to Cersei's female role model, for sure the first person, great IR who comes to my mind is Professor Anna Maria Belli, who has been Cersei past president and for sure is a role model for any woman who are striving for a career in IR. Then, for example, Dr. Irene Barzellini, an Italian interventional radiologist who has been interviewed by our ETF member, Dr. Rosa Cervelli, a few weeks ago, and you can find her interesting and inspiring interview in our Facebook page and in the Cersei website. Moreover, still Dr. Alex Barnicle, who is a pediatric interventional radiology from UK. I had the pleasure and honor to interview her last week, and soon you will be able to hear her inspiring word as well in our Facebook page and in the Cersei website. And moreover, last but not least, Dr. Maria Tsitskari, a colleague and friend. She's, I think, an example for all of us to how it's possible to become part of Cersei committees and do great work. She's also one of the organizer of the EBIR, and she will explain us later on how to prepare it. So what could Cersei do to make IR more attractive for female medical students and radiology trainees? We asked actually this question to IR women, and we got different answers, but the most frequent were that Cersei should support work and training options that allow family life. For example, help with the possibility to have shorter work hours, shorter week, for example, and also to have more female committee members and society leaders. We started really well, for example, with Professor Anna Maria Belli, which was president, and I hope we will have in the future as well another female president. So feature more women in Cersei publication and address pregnancy concern in radiation safety education, also for medical students and young radiologists. Then push to have more female role model, mentorship programs, and so on. More IR exposure to at university, increase awareness with students, which is something that ETF, the European Training Forum, is really trying to do. And I think we have succeeded in that in those last 5 years. And then, of course, more female speakers in congresses. Actually, you will be able to see more female speakers during the next Cersei 2020 summit. And I hope you will also attend the Women in IR session and meet your future female IR role model. During this session, they will speak about many interesting things, as, for example, all the challenges and the rewards you can find during your path in the interventional radiology career, and also, for example, how diversity actually matters in everyday work life. To have a work environment with women and men, for sure, it's much better. And also, for example, the idea, the female perspective of boss and VS leader. So we will learn so much, and we will hear during this Congress many interesting things. So now I will introduce Maria Tsitskari from Cyprus, Greece, who will continue with the Cersei supporting next year's generation and how to prepare a BIR.
Just a small overview once more. So Cersei has organized this student program, Cersei Be Inspired student program. This is held once per year in this annual meeting, trying to help medical students get to know what is IR, know what are the IR procedures, get familiar with IR procedures. Some of the highlights of this meeting, which is really I think it's really great for medical undergraduate students to join. Some of the highlights, one of the interesting event of this meeting is the students quiz, which is really fun. Students can participate, you can show your knowledge and share your knowledge of IR, and if you're lucky and you can be the winner, you might get a small award. Then another highlight of this program is the mentoring event, where you can meet some of the mentors, some of the professional IRs. You can discuss with them. You can discuss how can you become an IR and what is the training program in different countries. And finally, a really good thing about this program is the students' lunch, where most of the students can spend most of their time and talk, discuss, networking with other medical students during the meeting. So if you apply to become a student, if you apply and you get a student membership, then you can have also free access to CVIR online. CVIR is the Cardiovascular and Interventional Radiology Journal, the journal of our society. You can have access to stream videos from past Cersei congresses on the Cersei library, and you can purchase certified online courses through the Cersei Academy at a significantly reduced fee. I will explain later on what is Cersei Academy. Also, all these medical students, they can have free registration for all Cersei events. Also in our website, Cersei website, you can have access to the IR curriculum, which is a dedicated curriculum for medical students, and it's a strong foundation for IR education in Europe. As I told you, Cersei is supporting all young IRs, medical students, but also young IRs, which are young IRs or IRs in training. And also, Cersei has launched in 2015, so for the past 5 years, the European Training Forum, which there are representatives from more than 30 countries, European and non-European countries. So junior IRs, residents or IRs, young IRs, they represent more than 30 countries, trying to promote, trying to help young IRs in different countries. And during, once more, in our annual meeting, there is a program which is dedicated for these young IRs, where they can have specific events and get networking opportunities in these dedicated sessions for the young IRs. If you apply to get also a junior membership, which is something that Cersei provides, you can get reduced Congress registration fees for IRs in trainees, residents, postgraduate students, interns. You can get free access to Cersei annual meeting for Cersei junior members through the IR training support program. So if you just submit an abstract either for oral or poster presentation, even if it's not accepted, then you can still get a free registration for the Cersei annual meeting. And you can also take part in these dedicated activities, the European Training Forum activities for IRs in training, and also eligibility for the EBIR examination. What is the EBIR? This is the European Board of Interventional Radiology. It's a voluntarily supplemental examination which is offered by Cersei, designed to evaluate interventional radiologists on the clinical and technical knowledge necessary to carry out safe and effective IR treatments for patients. Right now, we have over than 670 EBIR holders globally. Candidates from more than 47 different countries have taken the exam. This is an exam that takes place 2 or 3 times per year. It takes place in the Cersei meeting and in the ECR meeting, and is endorsed by the ESR and by the UMs. Why do IRs should take the EBIR? What are the advantages? What can offer you in the future for your career? It can give you provide you further career development. You can gain a recognized certificate, the EBIR certificate, present an additional professional qualification as an add-on to traditional radiology training schemes. With this diploma, you can have an increased job mobility across Europe as well as globally, and to assert credentials vis-a-vis non-IR competitors. And here we can see some of the already EBIR holders. They shared with us our thoughts. They shared with us why did they take EBIR. So because it's a measure of their knowledge, that's what they say, because they wanted to have the chance to practice in Europe, because they thought that EBIR is an important part to strengthen their field, and that's true. Because in some of the countries there is lack of formal subspecialty of IR, and this is a proof of being recognized certified interventional radiologist, and because they thought that it can boost their career, and it's a way to guarantee a standard of quality. How to prepare for the EBIR? If you visit the Cersei website, then you can see this the European curriculum and syllabus for intervention radiology. All the examination questions are created according to this curriculum and syllabus, so you can use this as your guide when you are actually studying. And in this syllabus, you can see all the different topics are provided. And next to each topic, there is a color code. Here we can see the color codes, green, yellow, red, and purple. And these color codes, actually, they indicate the frequency with which a topic is tested within the EBIR examination. So it can guide you where you can have to focus more or where you can focus a little bit less in which kind of topics. How to prepare for the EBIR? There are great tools that Cersei provides. So except from different medical books, that there are plenty out there which are really useful, you can use different great tools that Cersei provides. One of these tools is the Cersei library that you, as a member, you can have free access to Cersei library, where you can see all the lectures from previous Cersei events, Cersei meetings, and there is a list there with recommended lectures, which are recommended lectures when you are trying to prepare for this EBIR examination. And a last but not least Cersei tool, which has been launched in the past years and it's really helpful, is the Cersei Academy. This is an online platform. It contains a lot of e-learning modules. These modules, they are providing comprehensive knowledge of IR. So each module, it's about a specific topic of IR, a specific procedure, and you can have either, you can get, these are paid modules, but if you are a junior membership, you can, or as a student, you can have reduced, you can get access to these modules with reduced fees. So thank you first of all for joining this session, and I would like to invite you to our next Cersei meeting. I can assure you that you are going to have to learn a lot of new things, a lot of great things, and at the same time, you're going to have a lot of fun. Thank you very much.
Thank you, Maria.
I don't know if there are any questions from the audience. If you want, there are things you want to discuss. I can see.
I actually would like to ask you, because you took the EBIR quite a lot of time ago, actually. So what was the most difficult thing, in your opinion, while preparing it?
When I took EBIR, as you said, I took it a lot of, like some years ago. We didn't have Cersei Academy.
Yeah.
I think that's a really great help now for the candidates who want to get prepared for the EBIR. So I got lost a little bit with all this these books, okay, in the beginning. But so I think that was the most hard part for me, getting prepared. I didn't know where to focus, where not to focus, and I didn't have the somewhere where I could find compact knowledge about a specific IR procedure.
Yeah, I think that now for sure this academy gives a kind of path you can follow. And if you study everything, you read everything, you have a good opportunity to pass the test.
Yes. And I think also if you, like for me, the best period to take an exam is after actually you finish with your residency and after when you start the first year of your subspecialty or towards the end of the first year of the subspecialty, because when you get familiar a little bit with all these IR procedures, then this makes it much easier when you want to take this exam.
Yeah, of course.
My personal experience. What, something else, Sarah?
No, thank you very much. Thank you, Maria, for being here, and it was really nice to see you also.
Okay, good to see you too. Goodbye.
Bye.